Welcome to another deep dive, and today we're tackling canine pituitary masses. We're looking at a 2024 study from Veterinary and Comparative Oncology.
Oh, this is a good one.
It is. It's looking at whether there might be a shorter, less stressful radiation option for these dogs.
Yeah, you know what I think is so interesting about this study? It compares two different types of radiation therapy head to head. The longer traditional one, that fractionated radiation therapy, FRT, and then the shorter, more targeted approach, that stereotactic radiation therapy.
It's RT.
Yeah, SRT.
Okay, so let's break this down. You've got a dog. They're diagnosed with a pituitary mass.
Yeah.
What does that even mean? What are we even talking about here?
So the pituitary gland, it's this tiny little structure, but it's so important. It's at the base of the brain, and it's making all those hormones that control everything. Growth, metabolism, reproduction, you name it. So when a tumor grows there, it can really wreak havoc.
Yeah, I mean, you're talking about putting pressure on the brain.
Exactly. Pressure on the brain, and then it messes with all those hormones, so you get all sorts of problems.
Yeah. And that's why radiation is often the go-to for treating those masses.
Right, because radiation can directly target the tumor. You're basically damaging the DNA of the cancer cells and hopefully stopping that growth.
So the goal is to shrink it, right?
Exactly. Shrink the tumor, relieve the neurological symptoms, and maybe even get those hormones back in balance.
So this study, like we said, wasn't just looking at radiation in general. It was comparing two different ways to do it. You mentioned SRT. What's the difference there?
SRT is all about that focused dose of radiation. You're giving it in a shorter amount of time. Think like 5 days, boom, 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 you're done. Whereas FRT, that's spread out over a much longer time, usually like 19 or 20 days with lower doses each time.
Okay, so it's like SRT is your quick, intense burst, and FRT is your marathon.
Exactly. The slow and steady approach.
What did they find?
Okay, so they looked at 44 dogs with pituitary masses. These dogs were at 3 different veterinary hospitals, by the way, which is pretty cool.
Yeah, why is that cool?
Because it means the results are more applicable to a wider range of dogs.
Makes sense.
So anyway, the key finding here, drum roll please, there was no significant difference in survival time between the dogs that got SRT and the dogs that got FRT.
Really? So that shorter, more convenient SRT protocol might actually be a real option.
That's what it's looking like.
Yeah.
The median survival time for all dogs, regardless of which treatment they got, was 608 days.
Wow. That's over 1.5 years. That's got to be such a relief for owners to hear.
Absolutely. It gives them hope, and that shorter treatment time, that can make a world of difference for some families. Less stress, less disruption.
So SRT, it's looking like a promising contender, but every study has limitations, right? What do we need to keep in mind about this one?
Right, good point. So this is what we call a retrospective study. That means they looked at data that had already been collected.
So they weren't controlling all the variables like they would in a
prospective study.
Yeah, a prospective study. Okay, so it gives us some clues, but it's not the definitive answer.
Exactly. Ideally, you'd want a bigger prospective study to really nail things down.
Okay, so this study points to some possibilities with SRT, but what else did they find out? Anything else jump out at you about these canine pituitary masses?
Well, they looked at the size of the tumor, like the ratio of the pituitary size to the brain size, thinking maybe that would predict how well a dog would do.
So bigger tumor, worse prognosis.
You would think so, right? But their analysis showed that size didn't really impact how long the dogs lived.
Huh. So size isn't everything.
Nope. It really highlights how complex these tumors are.
And speaking of things we don't fully understand, one of the biggest challenges with these tumors is being able to tell in advance which dogs are going to decline neurologically after radiation therapy.
Oh, that's the crux of the matter, for sure. The study found about 18% of the dogs across both groups did experience that decline, and they either died or were euthanized within 6 months after radiation.
Oh, wow. And there's no way to predict which dogs are more at risk.
Well, that's the burning question. They looked at a bunch of factors like tumor size, how bad the neurological signs were, even if the tumor was producing hormones or not. Nothing really panned out as a consistent predictor.
So even with these promising treatment options, there's still that big unknown.
And that's where future research needs to focus. Can we find a biomarker, some kind of genetic marker that can give us a clearer picture? Can we figure out who might need a different approach or some extra support to prevent that decline?
Okay, so this is all really important for anyone dealing with this diagnosis. What's the big takeaway for our listeners right now?
Well, if your dog is diagnosed with a pituitary mass, know that radiation is a key treatment, and you can talk to your vet about both SRT and FRT.
So having more informed conversations.
Exactly. Making the best decision for your furry friend.
And this deep dive is far from over. When we go back, we'll be exploring more of the details about treating these masses. What can our listeners look forward to in part 2?
We'll dig into the finer points of the study, talk about what this means for the future of veterinary oncology. Stick around.
We're back and ready to keep digging into those canine pituitary masses.
There's a lot to consider here, and I think this next point is going to resonate with anyone who's ever dealt with cancer.
Okay, lay it on us.
So the study found that younger dogs, regardless of which type of radiation they got, those younger pups tended to have longer survival times.
So a little bit of hope for the youngsters.
There is. It's definitely something to factor in when you're talking treatment options with your vet. Age isn't the only thing, of course, but...
It seems to play a role.
Yeah, it does. And, you mentioned earlier that the study also looked at whether the tumor was functional, like if it was actively making hormones.
Right, versus non-functional.
Exactly. And did that make a difference for how long the dogs lived?
That's what I was wondering.
Well, surprisingly, it didn't, at least not in this study. Whether or not the tumor was pumping out hormones didn't seem to impact survival time.
Wow, that's kind of wild. You'd think that would make things more complicated.
You would, but the data didn't really show that. Of course, like with anything, more research would be helpful.
Right, always more research.
Always. But it's an interesting finding nonetheless.
Okay, before we move on, I want to circle back to something you mentioned earlier about predicting which dogs are more likely to decline neurologically after radiation.
Ah, yes. Tricky.
It is. So we know what happened to about 18% of the dogs in this study. But is there anything owners can do to try to prevent that from happening?
Ooh, that is the question, isn't it? Unfortunately, right now, we just don't have any clear-cut answers. The researchers tried to look at different factors, but none of them reliably predicted which dogs would have a tougher time.
So where do we go from here? What's next for the research?
Well, I think the next big step is to find better tools for predicting those outcomes. If we can figure out which dogs are at higher risk early on, then maybe we can tailor their treatment plans or give them extra support.
So it's about getting ahead of it.
Exactly. It's about moving towards personalized medicine for our furry friends, really understanding what works best for each dog.
I like it. Now, before we wrap up this part of our deep dive, I want to talk a little bit about the study design itself.
Okay.
You mentioned it was multi-institutional, that it involved 3 different veterinary hospitals. Why is that important?
Well, it makes the findings stronger because you've got data from different places, different populations of dogs.
So it's not just a bunch of dogs from like one specific area.
Right. You get a broader perspective, so the results are more likely to apply to a wider range of dogs.
It makes the findings more relevant to your dog no matter where you live.
Exactly. And that's the beauty of these multi-institutional studies.
It's about getting that big picture view.
Yes.
Okay, so we've covered a lot of ground here. For our listeners who are maybe just tuning in, what would you say are some of the key takeaways from this part of the deep dive?
Well, I think the biggest message is that radiation, both the traditional kind and these newer forms, they can be really effective for treating pituitary masses in dogs. And this study, it's given us evidence that a shorter, more intense course of radiation might work just as well as the longer traditional course.
So more options on the table.
Exactly. And that's what we want, right? More options for dog owners and their vets so they can choose the best approach for each individual dog.
Okay, before we head to the final part of our deep dive,
Yeah.
anything else you want to highlight? Anything that really stood out to you?
One thing that I thought was pretty encouraging was that none of the dogs in the study who had follow-up imaging showed any signs that their tumor was growing back after radiation.
Oh, wow. So the radiation was really keeping those tumors in check?
It seems that way. Of course, not every dog in the study had that follow-up imaging, so we don't have the complete picture.
Right. Good point.
But it's still a positive sign that both SRT and FRT can be effective at targeting these tumors.
So ultimately, it's about improving quality of life for these dogs, giving them more time with their families.
Exactly. And even though we're still figuring out how to predict which dogs will do best with which treatments, this study gives us more tools to work with, more reason to be hopeful.
I love that. Now, we've been talking a lot about the science here, but obviously there's a big human element to all of this. What advice would you give to pet owners who are facing this diagnosis with their dog?
I think the most important thing is to not lose hope. There are treatment options out there, and research is constantly moving forward.
It's about being an advocate for your furry friend, exploring all the possibilities.
Absolutely. Talk to your vet, ask questions, do your research. There are also a lot of great resources online and support groups where you can connect with other people who are going through the same thing.
It can feel so overwhelming, when you're dealing with a serious medical condition, whether it's your own health or your pet's.
It can, but you don't have to go through it alone.
Well said. Okay, so we've had a really in-depth conversation here. What are some of the key things you hope our listeners take away from this deep dive?
I think the most important message is that radiation therapy, in both its traditional and newer forms, can be an effective treatment for canine pituitary masses. This study provides evidence that a shorter, more intense course of radiation might offer a comparable outcome to the longer traditional course, and that opens up more options for dog owners and their veterinarians.
So it's all about finding the best approach for each dog.
Yes, exactly. And remember, knowledge is power.
No.
The more you know, the better equipped you'll be to make informed decisions about your dog's care.
Okay, before we move on to the last part of our deep dive, anything else you want to mention? Anything we haven't touched on yet?
Well, we've covered a lot, but there are always more layers to peel back. When we come back for the final part, we'll explore some of the potential side effects of radiation therapy and talk about other treatment options that might be available.
So stay tuned, there's still more to come. All right, we're back for the final part of our deep dive into canine pituitary masses and the latest research on radiation therapy.
It has been a great discussion. We've learned a lot.
We have, and before we wrap things up, I want to talk about something that I'm sure a lot of our listeners are wondering about. Side effects. Radiation therapy, it's powerful stuff, so I imagine there are some risks.
You're right. Any medical procedure has risks, and radiation therapy is no exception. But the good news is that with careful planning and monitoring, we can often minimize those side effects.
That's good to hear. So what are some of the common side effects? What might owners notice in their dog during or after treatment?
Well, in the short term, you might see some skin irritation where the radiation was given, maybe even some hair loss in that area. Some dogs might be a little tired, maybe not as hungry during treatment.
Okay, so pretty manageable stuff.
Usually, yes. And then long-term effects, they're less common, but always a possibility. In rare cases, the radiation can damage some of the healthy tissue nearby, and that could lead to neurological problems down the line.
So it's a balancing act, weighing the benefits against those potential risks.
Exactly. And that's why it's so important to have those conversations with your veterinarian. They'll be able to look at your dog's individual situation and help you make the best decision.
Now, we've talked a lot about SRT and FRT, but are there other options out there for treating canine pituitary masses?
Yeah, sometimes surgery is an option, especially if the tumor is small and easy to get to.
So it really depends on the specifics of the tumor.
It does. And the dog's overall health, too, of course. And there are also medications that can help with some of the symptoms.
Like if the dog is having seizures?
Right. There are drugs that can help with that.
Yeah.
Or if the tumor is messing with the hormones, there are medications for that, too.
So it's often about using a combination of things.
It is. It's about finding the right mix of treatments for each individual dog. Personalized medicine, that's what we're striving for.
Absolutely. Now, looking ahead, what's on the horizon? What are some of the exciting areas of research in canine pituitary masses?
Oh, there's a lot going on. One area that's really promising is the development of more targeted therapies. You know, scientists are working to identify the specific molecules and pathways involved in how these tumors grow.
And then using drugs to target just those areas.
Exactly. It's like a guided missile going straight for the cancer cells while leaving the healthy cells alone.
I love that analogy. So less collateral damage.
Exactly. And then there's immunotherapy, which is basically using the dog's own immune system to fight the cancer. We've seen some amazing results with immunotherapy in humans.
Yeah, absolutely. It's revolutionized cancer treatment in so many ways.
It has. And there's more and more evidence that it can be just as effective in dogs, at least for certain types of cancer.
It sounds like the future is bright for veterinary oncology.
It is. And a lot of that is thanks to the hard work of researchers, veterinarians, and of course, dedicated pet owners who are willing to participate in these clinical trials.
It's a team effort, for sure. Well, this has been an incredibly informative deep dive. As we wrap things up, what are some of the key takeaways you want our listeners to remember?
Well, if your dog is diagnosed with a pituitary mass, don't give up hope. There are treatment options out there, and new ones are being developed all the time. Talk to your vet, ask questions, stay informed, and never underestimate the power of love and support.
Beautifully said. And to our listeners, thank you for joining us on this journey. We hope you found it helpful and maybe even a little bit empowering.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.